You are tuning in to the Aged Care Nursing Journey podcast. From our experience to your success. I'm An Do, the founder and host of this podcast. I am a registered nurse and senior leader in the Australian aged care sector, currently working as a regional general manager, overseeing multiple residential aged care facilities. You may notice my Vietnamese accent. That is part of my story and who I am. I came to Australia in 2008 from Vietnam, where I gained intensive experience in acute care, including the operating room and ICU. Since arriving in Australia, I have also worked as a care manager and deputy director of nursing across different organizational models, including for-profit, not-for-profit, and standalone residential aged care facilities. During my leadership journey, I have seen many registered nurses believe their career options are limited to direct bedside care. But the truth is, aged care offers a clear, highly structured pathway that allows experienced nurses to grow from the floor into facility leadership roles. You are not stuck. Your skills are valuable. Your experience can take you further than you think. In this episode 6, I invite you to explore the pathway from registered nurse to clinical care manager in a residential aged care facility. Together, we will break it down step by step so you can see what is possible for your own career. If you are new to this podcast, a very warm welcome. I'm so glad you are here. Please consider subscribing so you do not miss any future episodes. And let this be one more positive step in your aged care nursing journey. Welcome to episode 6 in the Aged Care Nursing Journey podcast series. As mentioned, today we examine the role of the care manager, often called the clinical care manager or deputy director of nursing. We will break down exactly how a registered nurse transitions from managing a single shift to managing the clinical operations of an entire facility. This diagram illustrates the clinical career ladder in aged care. Everyone starts somewhere, often as care staff or personal care assistants, often called PCAs, who provide direct daily living support to residents. From there, the trajectory scales upward through enrolled nurses and registered nurses, offering a clear structure that many acute care hospital environments lack. Reaching the care manager rung resolves a common career conflict. It offers executive level compensation, typically ranging from $110,000 to over $158,000 annually. Crucially, it also transitions the nurse into standard business hours, eliminating rotating shift work and securing consistent family time. The care manager serves as the architectural link for the facility. They take high-level national legislation like the new Aged Care Act 2024 and translate those mandates into the frontline day-to-day clinical reality for every resident and staff member. Stepping into this role requires a shift in perspective. A bedside nurse writes and follows a care plan for one resident at a time. The care manager holds the baseline accountability for overseeing the individualized, person-centered care planning for the entire facility. This chart shows the care manager directly below the facility manager. They build daily rosters to meet strict national mandates. 215 minutes of direct care per resident, including 44 minutes by an RN. The care manager directly oversees RNs, ENSs, and care staff to hit these targets. Facilities are also mandated to have a registered nurse on site 24/7. The care manager ensures this strict compliance through strategic workforce planning and shift coordination, rather than working those overnight shifts themselves. They also provide clinical oversight for highly complex procedures. This includes advanced wound care, dignified palliative support, and managing peg feed. A peg feed utilizes a percutaneous endoscopic gastrostomy, which is a tube passed directly into a patient's stomach through the abdominal wall to provide nutrition. Care managers engineer the complex operational and human system that allow safe, evidence-based care to be delivered continuously at scale. This scale requires systemic clinical governance under Strengthened Quality Standard 5.1, mandating frameworks for safety and accountability. A core tool is the risk register, which the care manager uses to proactively identify and mitigate hazards like medication error before they reach the residents. They rely on hard incident data and regular clinical audits to evaluate the facility performance. This data drives the monthly and annual executive reports that the care manager presents to the governing board. Gathering accurate data requires an open environment. The care manager actively fosters a speak-up culture among frontline PCAs and RNs. This supports CQI or continuous quality improvement, a structured organizational process for involving personnel in executing a continuous flow of improvements to provide quality care. Clinical governance operates as the proactive architecture of the facility. It is the system that guarantees resident safety and ensures the organization's regulatory survival. Operating within this regulatory environment means navigating high-stakes mandates like SIRS. SIRS is a Serious Incident Response Scheme, a mandatory national framework requiring aged care providers to identify, record and report incidents of abuse or neglect. Under the new Aged Care Act, the care manager must adhere to strict reporting timelines. Any Priority 1 incident must be reported to the National My Aged Care portal within exactly 24 hours of occurring. Priority 1 incidents include unexpected death, serious injury, or abuse. In contrast, Priority 2 incidents which cause lower level of harm or discomfort allow a 30-day timeline for thorough investigation and reporting. The care manager enforces the strict minimization of restrictive practices, placing them at the absolute peak of the intervention pyramid. As a last resort before any restraint, they mandate behavior support plans using environmental modifications and de-escalation tactics. These foundational non-pharmacological alternatives must be completely exhausted first. By enforcing these plans and monitoring the data, the care manager acts as the facility's ultimate ethical and legal safeguard against the systemic misuse of restraints. Overseeing high acuity interventions from complex ID therapy to managing behavioral symptoms require flawless clinical documentation from the nursing team. This documentation links directly to UNPAC. UNPAC is the Australian National Aged Care Classification, the federal funding model that paid residential facilities based on the scientifically assessed care needs of each individual resident. If a resident's acuity increases, the chart must accurately reflect the new clinical reality. Precise charting dictates the exact level of government funding the facility receives to support that precedent. Securing the correct UNPAC funding determines whether the facility can actually afford to hire. The staff needed to meet those mandatory 215 care minutes. We discussed earlier, clinical accuracy dictates financial viability. The care manager balances the clinical mission of the facility with the operational margin required to keep the doors open. Beyond compliance and finance, the care manager had an explicit duty to develop the workforce. They actively mentor nursing students, new graduates, and junior registered nurses. This structured mentorship aligned with APRA professional standards set by the Australian Health Practitioner Regulation Agency. Mentorship ensures these standards are met while building a sustainable pipeline of future leaders. Ultimately, the success of this leadership is measured quantitatively through the QI program. This is a government framework requiring providers to collect and report specific clinical performance data. Every 3 months, the care manager tracks 11 specific indicators against national benchmarks. They monitor the facility's rates of pressure, injuries, physical restraint use, unplanned weight loss, and preventable hospitalizations. Utilizing this data to target areas for immediate improvement. True leadership in aged care means looking past the minimum requirement of an audit. It is measured by the continuous quantifiable improvement of the residents' quality of life. This diagram shows the complete clinical career ladder. Reaching the care manager level requires mastering systemic facility leadership, including governance, risk identification and management, and workforce management. The care manager role serves as the definitive proving ground for gaining this business acumen and compliance expertise. Successful care managers use this experience as a strategic platform to move into general manager or regional clinical governance roles. Thank you for joining in supporting the Aged Care Nursing Journey podcast. Please subscribe to our YouTube and Facebook channels and reach out via email to share your own clinical journey with our community. Join us next time for episode 7, where we will analyze the final step of the ladder, the general manager role, and what it takes to run the entire facility. Clinical excellence in aged care is a demanding practice, but it is also a powerful upwardly mobile career path open to anyone willing to master the system. This brings us to the end of this episode 6. I hope you find the information shared today useful and it can assist you to gain some insights in the clinical care manager role and its responsibilities. If the care manager role aligns with your skills and future career goals, but you're not sure where to start or how to prepare, please don't hesitate to reach out to our team for individualized support, coaching, and guidance. My team and I look forward to welcoming you back to the next episode 7, where we will unpack the general manager role and draw a career growth pathway from a clinical care manager to a general manager. Take care and goodbye for now.